I got a message that said it was streaming live, but that message has gone
And
away.
and we are live.
Okay.
So, good morning to you both. Despite the minor technical challenges we face to get us live, I'd like to say welcome to you both, Dr. Cheryl People, Bermuda's outgoing Chief Medical Officer. I welcome you, and Bermuda's incoming Chief Medical Officer, Dr. Ayoola Oyinloye. Welcome to
Hello.
you both. My name is Adiraka Badamosi Wilson, and I am the Director for Government's Department of Communications. And I'm honored to have this conversation with you both. I'll start with you, Dr. Peekball. Tell us a little bit about you and what has gotten you to this point.
So if you're sure we're live, I'd like to first thank you. I'd like to first thank you for having us on and for literally holding my hand for the last 6 months as we've been battling the COVID pandemic. But going back to the beginning, I've been connected with the Ministry of Health since 1990 when I joined as a medical officer for maternal health and family planning, and was very happily engaged in that kind of work straight through till the early 2000s when I became senior medical officer in 2009. And after that, with the support of my mentor, Dr. John Ken, the former chief medical officer, I was appointed to this post as chief medical officer in 2013. So it has been a very long road with a lot of memories that I will share with you in a minute. And I will be retired as of today, I think at 5 o'clock or maybe midnight, I'm not sure.
Thank you, Dr. People. Dr. Aya, please tell us about yourself and what brought you to Bermuda.
Oh, hello everyone. My name is Oyinloye. Recently started earlier on this month as Bermuda's Chief Medical Officer, and I've been incredibly fortunate to have a period of overlap with Dr. Pickball, who's been extremely generous with her time and her knowledge, um, trying to bring me up to speed with all that's been going on. Prior to coming to Bermuda, I worked recently as a Deputy Director of Public Health and Consultant in Public Health, and most recently, the Director of Public Health for Swindon Local Authority, where, like everybody else in the world, since the beginning of this year, I have helped with the response to the COVID pandemic. So I am in Bermuda now, trying to fill the big shoes that Dr. Pickball has left behind, and trying to continue to support the fantastic work that everybody has done so far in Bermuda.
Excellent. Well, thank you and welcome to Bermuda. Indeed, you've come at an interesting time in global history, especially global medical history. The first pandemic of this nature in 102 years. Um, Dr. Pete Ball, what would you say some of the highlights of your career have been uh, when you look back on the history of your path as a doctor?
Well, as I said before, it's been quite a long career, 29 years and 8 months, I believe, in Bermuda. And the highlights are varied. They really depend on the role I was playing. When I was in maternal health and family planning, the highlights were all centered around teen pregnancy prevention and the successes that gradually rolled out over the early 90s, and also in breastfeeding promotion. And a lot of our focus was on sexual health and keeping people aware of the risks. And there were many highlights during that period that relate to teen pregnancy prevention, breastfeeding promotion, and sexual health. As well as during the 90s, there was a lot of work on building a collaboration between the Ministry of Education and Ministry of Health. So I really enjoyed and considered a highlight the early days of the comprehensive school health program and building awareness around how important general health was to well-being and scholastic achievement. And that program had, over the years, with the vigorous input from the Health Promotion Office and all the stakeholders, has evolved into Healthy Schools. And I always enjoy attending their annual Healthy School Awards, even though that's not directly connected with my work, just because I appreciate the importance of the collaboration between health and education. But more recently, working in the policy realm as senior medical officer and chief medical officer, I would say the highlights would be the the collaboration with so many different stakeholders that this role has allowed, and particularly in achievements like achieving elimination of transfer of HIV and congenital syphilis. That was a very big effort, very many collaborators, and really, I think, will go down as something I'm quite proud we were able to do in Bermuda with all the other things we had to do at the time. And also the chronic disease risk factor survey, the STEPS 2014 survey, which we did. We're all quite proud of that effort. And we're looking quite forward to the STEPS 2019 survey, which was implemented and had been in the field for a couple of months before the pandemic hit. So those are two of the more recent areas of highlights, I would call them, for the career, and were areas that I would love to have seen continue, except that we have been sidetracked dealing with this pandemic. And so in this setting, the real highlight has been the collaboration. All of the stakeholders who you didn't think about as being so integrally connected with health, from all of the national security stakeholders and the tourism and transport. We're all working so in such collaboration and coordination to deal with the pandemic. And so that really, that's the mother of all highlights, I would say, as I leave. That's really something I will never forget, is the collaboration of all the stakeholders to address the pandemic as it relates to Bermuda.
Thank you, Dr. People. Um, what single or several pieces of advice would you give to Dr. Ayo as the incoming Chief Medical Officer? If you two were just sitting down having coffee,
Yeah.
what would the conversation look like?
Well, luckily, he is a very experienced and well-trained epidemiologist. So, from a technical standpoint, there wouldn't be there wouldn't be much advice except to prioritize. There are so many demands coming from different directions, and they're all important, but some of them are very important and critical. And I often would leave work at the end of the day and I would ask myself, have I prioritized properly? Not have I worked hard, because we all working hard. But
Mhm.
the real difference between working hard and getting important things done is prioritizing. And so I just would support his prioritizing in the most vigorous fashion. And I guess a bit of personal advice would be not to be led by your email inbox, but rather by the things that you know are important in the health system and the things that you must achieve, because you can actually spend 24 hours a day
Oh,
answering emails and you won't be finished. So I've started to compare it to doing laundry. It never ends. So just don't worry, don't worry about it. Set your priorities and focus on those. That would be my parting advice.
Well,
thank
Dr. People, that sounds like good advice for anybody, regardless of
Yeah.
the new CMO. So I'll take that on board for myself as well.
And me too. It's a daily effort. It's a daily effort.
Dr.
you.
Ayo,
Hello.
um, you've just come to Bermuda
Yep.
recently, and you get to look at Bermuda from a completely different perspective as a professional coming in, having worked on the pandemic outside of Bermuda. How do you see Bermuda, first of all, from a medical perspective, but then very specifically, how we have managed our crisis so far?
Oh, thanks. It's really been very interesting. Coming to Bermuda has been quite high opening for me. Um, I'm in the very unusual position where uh, I am not necessarily limited by resources at the moment. All through my career is about making do with little or making do with less. Um, and the political will to get things done cannot be denied here. And that has translated to the resources made available to be able to tackle this pandemic. So for me, that's something that's unusual in my career, and it's something that I really appreciate. So coming back, your question was about how this compares to the UK.
Yeah, yeah, yes. How are we doing? Yeah.
Yeah, absolutely. I think we are well. Uh, the difference is very clear actually, because um, we don't have sustained community transmission in Bermuda at the moment, which is very different from most parts of the world. Certainly, in the UK, there is still community transmission, and the town of Swindon, where I come from, we've had quite a bit of outbreaks. Started off as um, mini outbreaks in workplace settings, but it's really gone out to a lot of community settings at the moment. We're fortunate in that we have a small population, well, right in the middle of the Atlantic Ocean. The only way you can come in is either by boat or by air. So we have good control of who comes
Yeah.
in to us. We can control who can bring the virus to us. And we have identified that as our front line of defense. And we have put into place a lot of measures to protect us. And even beyond that, we have very good structures to be able to deal with the one or two cases that may slip through the net. So it's extremely heartwarming to see all the hard work that colleagues have done so far.
Excellent. Well, thank you. Thank you. I'd just like to remind those that are watching us live, if you have any questions that you'd like to ask either Dr. Ayo or Dr. Pete Ball, post your questions. We are monitoring some of the comments. Um, we've got one person saying, thank you, Dr. Pete Ball, and congratulations on your retirement. Um, and so people are sending their well wishes to you and welcoming you, Dr. Aya. So, but I encourage if there are any questions, post them, and I'll read them. And so, um, Dr. People, I know people are curious, so I'm curious. What's next for you? What are you doing after? What are you doing tomorrow? Your put your put your microphone on.
Yes, because I muted myself because I am in a throughway of sorts. Um, yeah, I was saying I did anticipate that question. And so I actually know what I'm doing tomorrow. I have, in order to make the transition not so abrupt, I actually have a Zoom call with Bermuda Health Council first thing in the morning. So that will help me to not be too disoriented. But then I have the pleasure of helping to take care of my father-in-law, who is quite up in age, and to sit down and reflect on how I can maybe channel my energy that's still left in ways to be helpful to the community. So I have built in a little reflection time into the next few weeks, reconnecting with family. But then
Mm,
very soon thereafter, I really look forward to working in ways that I call community building, helping Bermuda in ways that I can at the grassroots within my neighborhood and community, getting to know the people in my community and understand what's important to them. I'm in Smiths Parish, and there are schools in Smiths Parish which make me know that I won't be bored as long as I can get to some young people and find a way to enrich their lives. So I definitely will be connecting with schools and with young people because I feel that education is pretty much the key to a happy life after good health. And so I know that I'm going to move in that direction as well as continuing to try to be useful to the public health sector. So that's a general answer. But for Tuesday, I'm pretty clear it's going to be a quiet day, me and my father in law.
Mm.
Excellent. Well,
The,
thank you. Well,
yeah,
I definitely wish you great successes as you move to the next stage
Yeah, thank you.
of a career. It sounds like you're carving
Thank
out
you.
your own path and how you want to spend the next few years. So, Dr. Aya, we got this question. It's interesting. Definitely not on our radar as we prepared for this conversation. So, I'm going to ask you because it came from an audience member. And the question is, do you have any objection to the new cannabis regime?
okay, right, okay.
So
The
I'm sorry.
okay.
It's a good thing I muted because that was a very loud laugh I gave. Sorry, Io. I should have
Okay.
warned you.
All right. Okay. No, it's fine. And I should have expected a question around this. It's there are several parts to this. And first of all, there's a legal aspect to this, and we all should seek to stay within the right side of the law. But from my perspective, the reasons we need to understand the reasons why people use cannabis and cannabis products. And the science is emerging that cannabis products and cannabinoids can be quite helpful in managing some chronic and long-term diseases. But it is emerging science. It's not, in many instances, it's not completely clear cut, and we need to continue to support the research and build up the body of knowledge so that we know where this is useful and where it's not. And so support our clinician colleagues to be able to prescribe appropriately. But there's also the flip side that some people, it's undeniably, some people use cannabis products for recreation and also it can be abused. It has been linked to developing mental health conditions, particularly psychotic type illnesses. Um, Another bit that needs to be considered is a lot of people use cannabis products to medicate undiagnosed depression or anxiety issues. Um, we need to make sure that people are using it for the right reasons and the science backs us up.
Okay. Thank you. Thank you, Dr. Ayo. I appreciate your comments. Um, we have another question from the those who are listening. But we also have quite a lot of comments about Dr. People saying congratulations and good luck as you move towards your retirement. And we also have wishing you well. Welcome to Bermuda, Dr. Oyinloye, and to your new post. That's from Isis Wellman. And I'm just quickly looking through some of the other comments. Again, thank you, Dr. Peatball, and welcome, Dr. Oyinloye. All the best to you both. Um, Looking at, so my next question um, for you, Dr. Ayo, is what do you see as the priorities for your office outside of COVID-19? Where do you anticipate spending your time?
Okay. Um, I, I'll tell you a little story. Before I started this job, I when I was interviewed for this job last year, what struck me as the most important priority, and certainly where I felt I was most able to contribute, was the Bermuda Health Plan and the um, plan to be able to provide universal health coverage to every Bermudan. And I felt that was precisely up my street. That was the sort of thing I want to be doing because, as a public health physician, I am very passionate about reducing health inequalities and unfair disadvantage that people may have because they don't have enough money. Um, Obviously, we all are in a different world now with the pandemic and everything that's happened, and that's sort of taken a bit of a back burner. But actually, the need for the Bermuda Health Plan is actually greater now, or something similar to that is actually greater now because a lot more people have lost their jobs, and with that,
Mhm.
the insurance is in a precarious situation. We are, uh, as a society, we need to agree that what levels of disparities we are prepared to tolerate and how we're able to support the more unfortunate in our midst. So, uh, absolutely right. The focus for everybody is about tackling this pandemic, and we should get this tackled. We should make sure we reduce our uh, new cases to zero and open up the economy for tourism. But soon after we've been able to get that, we would need to face and address the issues of access to health and healthcare by all Bermudians. So that to me is priority.
Excellent. Thank you very much for your thoughts. So as we prepare to close, I'd like to ask you both. Um, well, first of all, Dr. Pete Ball, uh, how has the office of the chief medical officer changed? How has your role in the last almost decade changed?
Well, there have been some substantial changes since I took the position in 2013. In the first instance, the office was split in two essentially, and management of the Department of Health, the oversight of that is now under the director of health. And the Office of the Chief Medical Officer has now been allowed to focus its energies on healthcare regulation and registration, primarily at this point, medical practitioners. Over the time that I've been there, the the allied health professionals and the dentists and pharmacists have transferred to the Bermuda Health Council. And so we can focus on physician registration and regulation, but also just in time can focus more on epidemiology and surveillance and doing um, not just outbreak um prevention and control, but also chronic disease uh, prevention and control and community assessment. So the office is much better able to really focus on some of the key public health essential services that would be assuring a competent health workforce and health protection from disease, including chronic non-communicable diseases. And so in many ways, the streamlining of the office's remit will make it a much more effective office. And I think that's something we in the ministry are quite happy about.
Okay. Excellent. And Dr. Aya, as you're stepping in, uh, how do you see your role even changing further?
Ooh, my crystal ball is quite fuzzy at the moment. It's clouded by our response to COVID-19. So I'm not able to see very far. So you pardon me for that. But I see the role of the chief medical officer as integral to health and healthcare on the island. Its role is more um, around influencing and providing scientific advice to the government on health and healthcare, and also supporting the government in its ambitions to um, provide health and healthcare to Bermudians. So exactly what that will entail remains to be seen, and a bit too early in the job to have a very clear idea of how that's going to pan out in the future. But I'm very clear about the office that Dr. People has so diligently handled over the last years and has entrusted to me. So I'll do my best to carry on our legacy.
Excellent. Well, thank you both. I'm looking at our time. We said we'll do about half an hour. And given that we started just a little late due to what we'll call technical difficulties, I will ask you both to give some closing thoughts, any final comments that you'd like to give. Dr. Ayo, I'll start with you.
Um, well, it was just a few comments to Dr. Pitbull to say thank you for your generosity with your time and with your knowledge, and so far, and to ask how you manage to achieve a work-life balance with everything that's been going on. So that would be something I'll be very interested in learning from you.
Dr. Pinkball?
That's a great question. And before I forget, I do want to say that my predecessor, Dr. John Can, gave me a piece of advice that I thought was not going to be as helpful as it ended up being, and that is stop working every night before bedtime, well before bedtime. Don't work right up until you jump into bed, and instead reserve a half an hour or so to read something that is relaxing and positive. And he and I are both lovers of literature, and that little piece of advice, that tidbit, really went far because in this job, you can literally work until bedtime, 10, 11 at night, and then you're exhausted and you jump in bed and you think you're going to sleep, but you're not going to sleep. You're going to keep working. And so that little advice of reading something pleasant before bed and kind of unplugging, it's really like a sedative almost. And so
Mm,
I hope you will do that. And as for work-life balance, I think it does take discipline because in public health, what I noticed about my colleagues is that they love public health. I love public health, and it makes it very difficult to balance. You
mm,
end up having to say, I'm going to have to stop working in this way that I love so that I can let my body rest and let my mind rest. And it takes a
mm,
lot of discipline. So I wish you well with that. I hope that you will take what I'm saying about cutting it off at a certain point in the
yeah.
evening to heart because it makes a difference in terms of your sustainability.
Mm,
But I would also like to say, I mean, people are so warm and encouraging to all of us. I appreciate how they have congratulated me on a job well done, which is really not, I feel, hitting the nail on the head because really it's been Bermuda that has done the job. And I appreciate how they're welcoming the incoming chief medical officer because um, it does indicate that there will be ongoing cooperation of the public and the private sector partners and everyone in continuing to make our management of the pandemic a successful one, a model for the world. So I do commend the community on its cooperation with public health advice because unlike countries around us that shall remain nameless, there has not been the conflict and the pushback from the public. People have, for the most part, embraced scientific evidence, have followed it, and have been very consistent with doing their very best to adapt this new way of moving through the world because it's not natural keeping our distance from
Mm-hmm.
people and
mm,
wearing masks, but people are adjusting to it, and I think we should be very proud of ourselves in Bermuda And I leave feeling very reassured that the incoming chief medical officer and the team here at the Ministry of Health will continue to be supported, and that the public will continue to comply with public health measures, because I think that makes all the difference, as we're seeing.
Well, thank you both. Thank you both for your time. I appreciate the opportunity to talk to you both in this format. Dr. Ayo, again, welcome to Bermuda.
Thank
I
you.
look forward to actually meeting you in person in the very near future.
Same
Uh,
here.
Physical distancing in place and all of that. So uh, we will meet in person very soon, I suspect. And so, welcome to Bermuda. And I really, truly hope that your time here is fruitful and rewarding. And I look forward to hearing more from you and your office as we continue through the COVID-19 pandemic.
Thank you. Thank you very
Uh,
much.
Dr. Peekball, uh, personally, I want to say thank you to you. It's been a pleasure, an honor for me to work with you very closely, especially over these last few months. But even over the years when we've had occasional meetings, I've always appreciated your guidance and support. So, on behalf of a grateful nation, I say thank you to you for your time and your sacrifices. I know that these last few months have been um, very, very demanding of you and your team at the Ministry of Health. And so I want to personally say thank you to you and your team,
Right.
but also say
Thank you,
thank you
Adaraka.
on behalf of the many people who have been watching and offering you best wishes um, and congratulations as you move to this next step. So
Thank you.
thank you both for your time today, and I look forward to hearing of both of your successes as you both take completely different roads now in your career. So thank you to you both.
Thanks,
Thank
Adaraka.
you. Thank you
All
very
the best
much.
to you.
Thank
All
you.
right.
Thank you.
Take care.